Hello, and thank you for joining us. I'm Sandy Potter here again with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and Sierra Drevline, Director of Employee Health Services for Masonicare. Welcome back to you all and happy April.
Thanks for having us.
Great to be here with you again. And Dr. Schwartz, I thought we'd begin with you. As we know, the FDA has authorized a second COVID-19 booster shot for those who are 50 years old and older. With new variants spreading in many parts of the world, when is the right time for folks to consider getting this shot?
Well, that's a good question, Sandy. And like I said, we've been doing these shows a year and a half or so, and each time we do it, I have more and more information to share. So bear with me, because I actually have two articles that I'm going to try to present. I condensed them and to just the main points like I do, but I'll kind of read them with you and give some key quotes as well. So the first article, it's entitled "Federal Agencies Authorize Second COVID-19 Booster Shot for Americans 50 and Older." And they say people age 50 and up are eligible for a second booster dose of COVID-19 vaccine at least 4 months after the first. And this is according to the FDA and the CDC. This is something they decided last Tuesday. And they go on to say that based on analysis of emerging data, a second booster dose of either Pfizer or Moderna vaccine could help increase protection levels for those higher risk individuals. Second boosters are especially important for those 65 and older and those 50 and older with underlying medical conditions that increase their risk for severe disease from COVID-19, as they are the most likely to benefit from receiving an additional booster dose at this time. That was actually a quote from the CDC Director, Rochelle Walensky. And the CDC signed off on the booster shot several hours after the FDA authorized them. So a second booster dose improves protection against severe COVID-19 and is not associated with new safety concerns. This is according to the FDA. And this is sort of important to note. There's certain medical conditions that increase the risk for severe disease, and these are obesity and diabetes, chronic lung, kidney, liver disease, heart disease, smoking, pregnancy, and actually many mental health conditions as well. So anyone immunocompromised in age 12 or older is eligible for another dose of the Pfizer vaccine, and immunocompromised adults can also receive the Moderna vaccine. For the immunocompromised, the initial vaccination is 3 doses, and they've been allowed since last fall to get a first booster or 4th dose, and are now entitled to a 5th. The CDC, this was according to CDC spokeswoman Christine Norland. And she further said people who received initial doses of the Johnson & Johnson vaccine can receive a second booster dose. And the J&J vaccine was initially, as you probably remember, a one-shot vaccine. Those studies suggested that 2 doses were needed to provide the same protection as the other 2 authorized vaccines. And the FDA cited an ongoing study. You may have read about this study among Israeli healthcare workers, 154 of whom received the 4th shot with the Pfizer vaccine, and 120 were boosted a second time with Moderna. And then 2 weeks later, both groups saw at least a 10-fold increase in levels of antibodies capable of fighting off COVID-19, while antibody levels continued to fall among those who didn't receive an additional booster. No new safety concerns were raised in either group, which is significant. So the FDA has determined that the known and potential benefits of a second COVID-19 vaccine booster dose with either of these vaccines outweigh their known and potential risks in these populations. And the CDC made similar points in its own statement and emphasize the importance of initial shots and a first booster dose. So they go on to say, data continue to show the importance of vaccination and booster doses to protect individuals both from infection and severe outcomes of COVID-19. Some experts raise concern that an individual booster does not provide much benefit to healthy people. And this is kind of an interesting additional point. The same Israeli study offered as evidence in favor of a 4th shot concludes that a 4th vaccination of healthy young healthcare workers may have only marginal benefits. Older and vulnerable populations were not assessed. And this is a final quote from Dr. Paul Offit. He's director of the Vaccine Education Center at the Children's Hospital of Philadelphia. And he said he's seen no convincing evidence that healthy people need extra protection against severe disease beyond the initial vaccines. And he goes on to say that a second booster offers only a little extra protection against infection with COVID-19, and it's not clear how long that benefit lasts. And finally, Stefan Bancel, he's the CEO of Moderna, said in a statement that boosters are needed to provide continued protection against COVID-19. And this is a quote that he said, "The virus continues to evolve. We are currently on the verge of another potential wave driven by the BA.2 variant. Now, healthcare providers have the opportunity to advise higher risk people about when and how to get boosted and build immunity in advance of future outbreaks." So I know that's a lot of information, and we just wanted to try to give you as much information as we can consolidated. Got one more article, but it's only a paragraph. I condensed, 5 or 6 pages into a paragraph just to give you the gist of it. And this one says, CDC director clears up confusion on second COVID boosters. So the head of the CDC provided more clarity on who should or perhaps should not consider getting a second COVID-19 booster vaccine, saying that a recent infection may in fact act as a, quote, natural boost in immunity. And this is the CDC director we mentioned, the Rochelle Walensky. She said, this is a quote, "If you've had Omicron disease in the last 2 or 3 months, that really did boost your immune system quite well." And she added that these individuals could wait another 2 to 4 months before their second booster. The decision about the second booster was especially intended for people ages 65 and up or ages 50 and up with chronic health conditions, as I mentioned before, who had received their first booster dose at least 4 months ago. The CDC also said that all adults who received 2 doses of the Johnson & Johnson vaccine could also get an mRNA booster. And Walensky further said that there are no known safety issues for those eligible for a second booster to get one now, even if they may need another shot this fall. So I think the final point, there's an advisory committee to the Food and Drug Administration, which is scheduled to meet to further discuss the future of COVID-19 booster shots. And you see that this is still a work in progress. There's lots of discussion, lots of debate, lots of evidence still being reviewed, and certainly we'll continue to try to stay on top of everything and keep you informed as we find new information. But I know this is the moment you've all been waiting for, my inspirational quote, which says, "No one ever injured their eyesight by looking at the bright side." So I like that quote because we all need to look on the bright side. And actually, the person I found that said this was Zig Ziglar, actually formerly known as Hillary Hinton, who was an American author, salesman, and a motivational speaker. And that was certainly a motivational quote, if you ask me. So what I always say is, again, thanks to everyone for all their hard work, their diligence. It's been a long fight. Things are getting better and better. We just have to continue to stick together, practice good health practices and immunizations. And as I always say, I wish you health and I wish you peace. Thank you.
Thank you so much, Dr. Schwartz, as always, for helping us to break down all of that information and for giving us our motivational quote that we do all look forward to each time. Thank you. Sierra, I'm curious to know what this latest news from the FDA, the CDC, means for us here at Masonicare. Will we be offering vaccination clinics for our residents and staff who now qualify for a second booster?
Hi, Sandy. Yes, we will. So we are very excited to be able to offer the COVID vaccine clinics once again through our pharmacy partnerships starting this month. The intention is to provide easy access to the vaccine for those who are eligible and for those who want it, because we know that not everyone eligible feels comfortable receiving it right now and are opting to receive it closer to the fall. But at this time, those who are eligible are those 50 years old and older who had their first booster 4 months ago or longer, and everyone 18 and older who received both a J&J primary series and booster, as long as it's been 4 months. So it'll be for staff and residents. Anybody who wants to receive it during those clinics certainly can. And we know from past experience that having the vaccine at our doorstep and at our workplace is very convenient and very much appreciated. So we look forward to continuing to work with our pharmacy partnerships to provide that vaccine. Thank you.
That's great, Sierra, and we thank you for all of your continued efforts on those vaccine clinics. And finally, JP, I know that we're all very happy to have springtime weather here, even on a rainy day like this. How are the Masonicare communities and our residents responding to the warmer temperatures?
Thank you, Sandy. We are starting to see our residents thrive again. At many of our residential living communities, we have lifted the mask mandate, not in the assisted living, not in the skilled nursing, but the mask for our residents and our independent living side. We are starting to see the mask coming off. Again, not in all areas, but with that freeing feeling, you're starting to see the smiles, you're starting to see the energy come back into the communities, and we're seeing more out trips, more activities happening than we have in over 2 years. And those smiles that you're seeing in the hallways, I think, warm everybody's heart. So we're excited to see the other side of this pandemic. And really, I can't say it enough. Our staff have been truly amazing during this whole ordeal. We actually just celebrated or had a milestone of taking care of our first residents and patients 2 years ago, a little more than 2 years ago now. And I just can't tell you how proud I am of our staff for everything that they've done. It's been an amazing time. It's been a time where we've been through a lot of stress, but we're getting back to normal. And our staff have done a truly amazing job. And I also would like to thank all of our residents. They also have endured so much challenge during this time. And as the masks have started to come off, as we start to see ourselves get back to some normalcy, we are seeing, I think, a energized resident coming out. I will say, though, we're not done with this. And I talk about the mask coming off. There may be a time where those masks have to come back on during really hopefully the seasonal flu time, where we may see that coming back. So we're not out of the woods, but we are in more of a normal state of mind, I think, for many of our residents and staff. So we will continue to stay Masonicare strong.
Absolutely, JP. Couldn't have said it better. Thank you all for sharing your time and your insights with us today, as always. And we thank you for joining us once again from home. Until we see you next time, we hope you'll stay safe and stay well.